Good evening, everyone. Today we will discuss about the COVID-19 vaccine. My name is Christina.
Hi, my name is Sarah binti Syahul Hamid.
Hi, I'm Yasmin Syed Sultan.
And my name is Yusuf.
Hi, my name is Rizwan.
And my name is Noor.
The first COVID-19 case in the world started in the year 2019 in a city of China named Wuhan. In Malaysia, the first case started on 25th January 2020, whereby 3 Chinese nationals were infected. However, the first ever Malaysian to be infected with the virus was a 41-year-old man on 4th February 2020. Based on the World Health Organization, COVID-19 is an infectious disease caused by a newly discovered coronavirus. WHO has also stated that there are 2 main categories of the highly at-risk individuals, and these 2 categories are 1. Those above the age of 60, and 2. are those with underlying medical conditions such as diabetes, chronic respiratory disease, and cardiovascular diseases. Sarah, do you know how COVID-19 spread?
COVID-19 spreads between people mainly when an infected person is in close contact with another person. Current evidence suggests that the main way the virus spreads is by respiratory droplets among people who were in close contact with each other. Other people can also catch COVID-19 when the virus gets into their mouth, nose, or eyes, which is more likely to happen when they are in direct or close contact, for example less than 1 meter apart, with the infected person. The virus can also spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are different sizes, ranging from larger respiratory droplets to smaller aerosols. The virus can also spread after infected people touch surfaces or objects such as tables, doorknobs, and handrails. Other people also may become infected by touching these same contaminated surfaces, then touching their eyes, noses, or mouth without having cleaned their hands first. So, for now, preventive measures should be taken to cut the chain of this outbreak. Do you agree with this, Yasmin?
Yes, Sarah, I agree with what you have said. Vaccination is one of the preventive measures taken with the purpose to control the spread among the healthy individuals. We understand that some people may be concerned and critical about getting vaccinated now that COVID-19 vaccines are available. Safety is a top priority, and there are many reasons to get vaccinated. None of the COVID-19 vaccine contain the live virus that causes COVID-19. So a COVID-19 vaccine cannot make you sick with COVID-19. Getting vaccinated is only one of the preventive measures that a person could take to prevent from contracting the virus. However, as we may know already, vaccine is not available for everybody and it differs according to each country. Each country has their own method of distributing the vaccine according to high risk patient, age group, and also significant sectors workers that need them the most. So what can those who do not belong in any of the category above do to protect themselves from contracting the virus? In this situation, what all of us can do to protect ourselves and others around us is by taking appropriate precautions and follow advice by our local health authority. To prevent the spread of COVID-19, we must clean our hands often. Maintaining a safe distance from everyone other than your family members are also important. Other preventive or precautionary measures includes wearing a mask when you are in public while maintaining a safe distance. Avoid touching your eyes, nose, and mouth because that is how the virus will travel into your body. The most important thing is to stay at home if you are feeling unwell, and if you have the possible symptoms, seek medical attention.
How does vaccination prevent us from this infection?
Actually, vaccination works by providing immunity after an infection. The person's immune system remembers what it learned about how to protect the body against that disease. Vaccines help this process by providing memory cells. We often develop lifelong immunity when we have had a disease. However, some diseases may lead to serious complications and sometimes death. The aim of vaccination is to obtain this immunity without any of the risk of having the disease. Further information, registration for COVID-19 vaccination to members of the public is expected to kick off in March, and this will be on a volunteer basis. So, where can we register for this COVID-19 vaccine? Okay, there are 5 ways for the public to sign up for the vaccine. First, through MySejahtera application, and the second, JAV COVID-19 Vaccine Supply Access Guarantee Special Committee. And the third, hotline number, manual registration at public and private clinics and hospitals. Lastly, for the people in rural areas, state government will get them to register the recipients, including senior citizens. Actually, there are 3 phases national COVID-19 immunization, and the first phase, February to April, is for 500,000 frontliners, and the second phase, April to August, for high-risk group senior citizen aged 60 and above, and the third phase, May to February 2022, for those aged 18 and above. Apart from Malaysia, 49 other countries have approved the vaccine, and some are already started using vaccine. Hence, I believe it is important for us to take the vaccination.
I understand your point, Rizwan. However, vaccination may cause side effects to certain individuals. What I read from Pfizer Center for Disease Control (CDC), most common side effect in the arm when you got shot is you will feel pain or swelling at injection spot and the redness at your arm. The worst part is you feel chills and headache, even tiredness throughout the rest of your body. However, this side effect usually start within a day or two of getting the vaccine. They may feel like flu symptoms and even affect your ability to do daily activities. Normally, take a few weeks for the body to produce immunity after vaccination. Therefore, it is possible that a person could be infected with the virus just before or after vaccination. This is because the vaccine did not have time to provide protection. So, what do you think about this now?
I agree with you, Yusuf, but I agree more with what Ridwan said, that vaccination is important as it provides higher chances of prevention. In my point of view as a frontliner, we are the most risk groups that are easily get infected with the viruses. Even though with the adequate PPE provided nowadays, at least with the vaccine, we can continue our work without fear and least risk associated or contract with the virus. We can also help to sustain essential health services during this crucial time. The reason why I said this is because frontline healthcare workers are particularly important in stemming the pandemic
preventing death and reduce severe illness. The goal of a vaccine is invented is to reduce harm and enhance the use to be benefited by us. And because of that, we must look at how much is the vaccines going to work in one group. I believe that there are many experiments that has been done by the scientists before it is recommended to be used. Meanwhile, we should do everything that we can to prevent from the virus spreading, and at the same time, the people who needs the vaccine get it. How about you, Christina?
I too, as a frontliner, agree that taking vaccination is crucial in order to protect oneself from the virus. However, I do believe that we should be given the option whether we are willing to accept it or not. These vaccinations are mandatory in some countries, but it is also a choice in some countries. The reason is that these vaccinations are still in its early phase and it might not suit or it might not be compatible to all individuals. The severity of the side effects differs from one individual to another. Therefore, more research should be done towards this COVID-19 vaccine. Though getting vaccinated is our only chance of bringing down this rapidly growing infectious rate, in my opinion, I believe that it is a better option to get the vaccination and endure the side effects but gain immunity against the infection rather than being vulnerable towards it. Do you guys agree that we should receive the vaccination?
Yes, I agree with you, Christina.
Yes, Christina, I agree with you.
Yes, I agree, Christina.
Yes, I agree with you, Christina.
Yes, I agree with you, Christina.